Brenda Lewis Robertson, and Lewis was my maiden name. I grew up at Gila River, and that's when I met this one doctor. And this was the one that I go to now, and he helps me out a lot. And this was the one that is in Mesa, this doctor, and is well versed in what he did for us. Not only me, but others. Not only the community, but all over here in the valley. Or wherever he's called to go, he does it. And his name is Dr. Brennan. And I really appreciate him because he helped me to save my legs, my life as a whole. I could have had my legs cut off, but he saved my legs, and now I'm doing okay.
My name is Dr. Scott Brannon. I'm the medical director for Modern Vascular. I'm here today to talk to you about a major health epidemic that has taken place in the United States and around the world. And it's the epidemic of type 2 diabetes. Diabetes is a disease that, when we talk about arteries, primarily affects small arteries. Now, the effect of those arteries being narrowed by diabetes is decreased blood flow. What happens when we get decreased blood flow to our feet? Usually there's pain associated with that. Frequently there's neuropathy, a lack of sensation, and then sometimes patients will actually begin to develop pain even at rest, and eventually develop ulceration, lose tissue on their feet. Unfortunately, once we reach that point of rest pain and tissue loss, those patients very frequently progress to amputation. I'm very proud to say that the practice I lead is dedicated to the treatment of critical limb ischemia, of peripheral arterial disease below the knee and below the ankle. This is our specialty. This is what we do every day. The principles have changed because the tools have changed and the disease has changed. And it's not every practice that has stayed up with that change. But I'm very proud to say that Modern Vascular is one of the practices that has stayed current with what patients need and the equipment needed to do it and the education required to achieve outcomes successfully and reliably.
My name is Richard Krein, and we're in the Mesa office of Modern Vascular. I went from being hardly able to walk from a Walmart parking lot into Walmart and just basically picking up a couple of items to get back to the car because the pain was so severe. And then I had to wait and let it calm down so that I could go ahead and drive the car and get home. If it wasn't for my better half going in to bat for me and forcing the heart doctor to come up with Scott Brannon's name, I really don't know where I would be today, in all honesty. Get the operations and have it done. Do not worry about anything else. Like I said, I'm a stage 3 kidney and a type 2 diabetic. The staff, everybody is well aware of everything that you have and you need, and they take very, very good care of you. I can tell you that just flat out. Now, it's like I've been rejuvenated. And now, you know, my grandkids come to visit and we go to the ballpark and we're walking around and running around and asking if they want popcorn. You want to do this, you want to play that, and then we go to games, we go to Disneyland. I mean, life is so much better, I can't begin to tell you. For anyone out there who needs to have this procedure done, Modern Vascular would be definitely the choice, you know, no question.
In April of 2017, I was involved in an auto motorcycle accident, and it caused a great deal of damage to my left foot. A 750-pound Harley elevated off the ground, crashed on my left foot knuckle, and caused the toe to become dead. My physician at the time sent me to Modern Vascular because I needed special blood opening treatment to bring the toe back from its necrotic stage to life again. The procedure was done, and almost immediately afterwards, I felt a difference. I noticed that my foot became warmer from its original cold state. The blood started circulating a whole lot better. You could almost see the healing coming with overnight and on a day-by-day basis. It just continued to get better and better and better over the period of the month. And when I came back for my month checkup, my toe was no longer necrotic. And within 90 days, I was walking without a limp. Today, I'm moving about freely. I'm back to teaching martial arts to young men and starting to enjoy life again. So I would highly recommend Modern Vascular to anyone.
My name is Doug Griffin. I've been a podiatrist practicing in the East Valley now for going on 20 years. I take care of a lot of people with diabetes. I've worked 10 years in a wound center. I've had lots of experience with people with diabetes. My experience with Modern Vascular has been fantastic. They've taken great care of my patients. Oftentimes where maybe someone with a small ulcer on a little toe, where maybe other doctors may not want to deal with that, I found Modern Vascular to be very attentive to even the smallest of problems. My patients have been very happy. Definitely I've seen people with wounds that I thought maybe might not heal, and I've had great results with Modern Vascular. And if you think about people getting out of bed without a leg or having to strap a leg on to get out of bed, it's a big deal. It's a huge impact on their life. There's about 70,000 diabetics every year that end up with some sort of a foot amputation due to diabetes and wounds. With Modern Vascular, able to prevent a lot of these problems, they've been a great asset to my practice. I've seen the results of these doctors at Modern Vascular. I'm not seeing that from other people in the medical community getting that low and solving these problems of the distal leg and the distal foot.
Hi, I'm Dr.s. I'm a board-certified family physician that practices out in Gold Canyon, Arizona, and have been here for 17 years. One of the things that I'm grateful for Modern Vascular is their ability to help individuals who have chronic peripheral arterial disease who suffer from the effects of diabetes. The treatments they've received there have been wonderful. They've been life-changing. There's been significant improvement with ulcers, with complications from poor circulation. And as I've sent patients there, the treatment they received has brought them great relief, has improved their quality of life, and has also been able to improve the outcomes for those individuals that suffer from arterial disease, ulcers, complications that we see in the medical field, unfortunately, routinely. One of the things that's made the referral process a lot easier for me as a primary care physician is this PAD evaluation form. I have one of these in all of my exam rooms, and I'm able to sit down and talk with the patients at the time they have concerns or questions or possibly complications. And we're able to go through the 11 questions that have been provided to me from Modern Vascular, and it's an easier form for me to do a quick evaluation and assessment to assess the nature of the disease as well as the seriousness of the disease. As a primary care physician, I am grateful for a company like Modern Vascular, who I can refer my patients to, who I know and I trust will get appropriate care and treatment and will improve the quality of life. It brings me great satisfaction to know that they're available for me and be able to help my patients with their PAD.
My recommendation for you is that if you've been told there's nothing that can be done to help fix your arteries, if you've been told that your mother or your coworker must have an amputation, the only thing I'm asking is for you to get more information. If there's a Modern Vascular in your area, I can assure you that those guys are going to be experts. Come and see us. Get your arterial evaluation. Don't wait until it's too late.